More allegations of mistreatment are emerging at KwaZulu-Natal's Estcourt District Hospital. 2 security guards were recently fired over the assault of a patient. Now a woman has spoken to eNCA senior reporter Dasen Thathiah about her husband's final moments at the facility.
2 security guards have been fired over the recent assault of this patient at the Estcourt District Hospital. This eNCA report has also encouraged another family to speak out about their relative's experience at the facility. Aziza Sheikh's husband, Mohammed Prinsloo, had breathing difficulties on the 23rd of February this year.
I spoke to the guy from the ambulance and I said to him, can you treat him here? I don't want him to go to the hospital. Because whenever we spoke about it, he always said to me, please, if I ever get sick, don't put me in this hospital. Because you know what happened to your mum there. My mum passed on 4 years ago at the hospital as well.
He was first taken to the clinic before Sheikh personally transported him to the hospital ward he'd been referred to.
My son and I helped my husband into the car, and all the way down to the ward he was gasping for air. And he kept on telling me, my time is up, Sheikh, I'm not going to make it. And as we got to the ward, from the door, I started screaming, please help us, my husband needs oxygen.
What was the response from the staff when you were saying that?
Okay, they're always sitting. They always relaxed, they were sitting. They started running to put on their PPEs, they started running to make a bed, they started running to get the oxygen cylinder and the masks and things. Nothing was ready. And this all took place between 5 and 7 minutes, and they didn't even direct us into which ward we must take him. We just found an empty ward opposite the nursing station. We found a bed, we made him sit there, and he was just gasping and he was battling. And I said, sister, can I please have the oxygen, She says, no, you have to wait, we need to make the bed. Which is more important? He needed the oxygen.
The next day, Prinsloo sent his wife a picture to reassure her. But it wasn't long before he started complaining of the treatment he was apparently receiving. While relying on oxygen, the former paramedic sent desperate text messages to his wife.
He was put on medication, but I think that had to do with the chest, and I don't think anything was given for food via a drip, because he kept on telling me, I haven't eaten since I've got here, and I'm feeling weaker by the day. And he says, so I said, why don't you ask the nurses? Must I phone the hospital? Must I ask the nurses to help you? He says, no, don't phone here. He says, they say I'm a difficult patient. They have changed my ward from, we left him close to the nursing station. They put him far away because the one night as well, when the oxygen got finished between 1 and 2 in the morning, he says he had to scream and scream and scream. There's no alarms, there's no bells, there's nothing goes off when the oxygen is finished. And the sister herself told me, no, we told Mr. Prinsloo, and we tell the patients in the ward they need to scream.
Prinsloo was worried.
Throughout the week, while he was texting me, he kept on telling me, they're going to kill me, I'm going to die. My time is up. And he says, no doctors come here. He said they bring in 2 Panados, they put it on his bedside and go. This is a patient with a chest problem. And till the day he passed away, no chest x-ray was done.
5 days after he was admitted, Prinsloo eventually received a visit from a doctor. But his struggles with the nursing staff continued.
Between 1 and 2, he was texting me. And I was contacting the hospital to say, please, can you attend to Mr. Prinsloo? His oxygen is finished. Why? For a person that went in there with a breathing problem, you understand, and needed oxygen 24/7, why was his oxygen running out at that time?
This is the final video Prinsloo captured on his phone.
On Sunday morning at 1:57, he phoned in. I think I was fast asleep, I didn't hear my cell phone. And then he phoned again, and this was a phone call. And he sounded panic, and he screamed into the phone, shake, shake, and he was like gasping for air and battling to breathe as he spoke to me. And he says, please call the hospital, I'm bleeding. and my oxygen is finished. And I said to him, where are you bleeding from, honey? What's wrong? And he said to me, please just call the hospital. You know, I didn't realize that would be the very, very last conversation I'd have with him. And I hung up on him. And it wasn't even a goodbye or anything.
Prince Lou passed away later on Sunday, apparently from COVID-19 complications.
I want to know what was the actual cause of death. I want to know if he bled to death. I want to know why weren't we called. I want to know why wasn't he transferred to another facility, because Estcourt Hospital cannot cope. We don't have ICUs here. We don't have ventilators here. They cannot cope with the patient in his condition.
Sheikh has been trying since Prince Lou's death on the 28th of February to get answers from the Estcourt District Hospital. Now, she's trying to get legal assistance to sue.
I'm not going to leave them, and I've given them a chance to be open with me and to be honest. When I'm asking for times, you know, the CEO actually burst out laughing in the first meeting. So I was very upset.
Prince Lou passed away on the day his daughter should have been celebrating her 21st birthday.
Oh, from Saturday, I would say he knew he was going to die. And I think he just wanted to come home and die. I know it's God's will. I know we cannot question God. I have faith. I believe that. But the negligence that he suffered, he didn't deserve it. And he saved so many people's lives when he was working on the ambulances. He, you know, he gave it his all. He was passionate. It didn't matter about your race or color. When it came to his care, he gave it 101%. And when he needed care in his last hours, he was just left there to suffer and die.
The KwaZulu-Natal Health Department has not responded to eNCA's request for comment on this case. Dasen Thathiah in Estcourt, KwaZulu-Natal.